Okay, I'm Angela Lee. I work in trauma and orthopaedics in the paediatrics section at the Royal Berkshire Hospital. My project is to encourage parents to become screeners to spot infant hip dysplasia in the early stages rather than leaving it till later on when the child's walking. We run the infant hip clinic at Reading, and the most devastating part is seeing parents who come in at when the child's about 8 months of age, and we've noticed the hips are dislocated, and some of the signs are that the hip is limited in abduction or there's a big extra fold. And the parents all say, we noticed that, but we didn't know what it meant. So what we tried to do is actually put what is easy for the parents to identify in a guideline, a guidance that we gave out to parents so they could spot the early signs. Because if we can get other people to do it, it will certainly help, especially as the 8-month check has now been taken away. Obviously, we recognise that the guidelines and trying to get these parents to spot it is important, but it's just lovely to actually see that it is something that other people also recognise as an important piece of work. I think not just from ourselves, but it's the exposure that it will get, and hopefully maybe lead it into something, a national programme would be fantastic. I think at the moment we've lost the 8-month check, as we've said. Babies are high risk now of getting through to walking age with a dislocated or quite a nasty hip. And if we can actually get something out there to spot them, there'll be so many infants and so many parents so grateful because we've actually done something much sooner than leaving it to their walking. I think at the end of the day, we need to get it out to, not say politicians, but the people who do the policies and people maybe in the public health sector to actually understand there is a shortfall out there now, and there's the risk that these babies will end up being young walkers with a dislocated hip that's going to require invasive surgery and maybe possible long-term risk of their hips and early arthritis.